Brain surgery has always been seen as a complicated procedure involving huge risks, but that's changing thanks to this cutting-edge brain surgery technique called gamma knife radiotherapy. It focuses gamma rays, a form of radiation, on targeted areas within the brain with very high precision, while sparing the surrounding tissue. This method is especially useful when there's a tumor or other abnormality in a deep area within the brain that's difficult to reach. Japanese doctors have been trying to advance gamma knife technology in order to help as many patients as possible.
Japan is a world leader in cutting-edge medical technology and healthcare services. Join us as we explore medical frontiers. Howard Samuelson is a 59-year-old American who lives in Japan.
Most of the day, and we...
He recently developed some unsettling symptoms.
Would you be able to call or FaceTime and let me know what's going on?
Right now, I've lost a feeling in my face, pretty much from my eye orbit here, all the way down to this part of my jaw, as well as the inside of the left side of my lips and the left side of my tongue. So when I say I'm losing feeling, it's not just a matter of going numb. It's a matter of it's always tingling. It feels as if I'm wearing a latex mask.
This image shows Samuelson's brain. His doctor identified a tumor about 2 centimeters wide. The tumor was putting pressure on his brainstem, a region that's critical for regulating vital bodily functions. If left untreated, Samuelson could eventually have problems with breathing and staying conscious. The tumor was located deep inside his brain, so standard surgery would have been difficult. His doctor decided to use gamma knife radiotherapy. It involves precisely targeting the tumor with radiation. Motohiro Hayashi is a gamma knife specialist. He has used the technology to treat more than 9,000 patients.
Some of the cranial nerves in the head can be very thin, like 1 millimeter or even less. For that level of precision, there's nothing like the gamma knife.
The procedure is also called gamma knife surgery, though no incisions are made. Instead, surgeons use gamma rays, a type of electromagnetic radiation. The radiation emitted by each gamma ray beam is low enough that it doesn't damage normal cells. By directing approximately 200 concentrated beams at the brain, it's possible to neutralize tumors. The radiation can be delivered at a precision of 1/10 of a millimeter, allowing doctors to accurately target tumors. When gamma rays are directed at a brain tumor, they damage the cell's DNA. This neutralizes the cells so they stop dividing. After treatment, the cells gradually shrink or disappear. Hayashi analyzes nearly 600 images of a patient's brain. He uses these to create a treatment plan. Brain tumors are surrounded by nerves. It's necessary to isolate the tumor from areas that shouldn't be irradiated. By superimposing pictures taken from a variety of different angles, Hayashi creates a 3-dimensional image. This allows him to identify the tumor's exact shape and location. Tumors tend to be irregular in shape, and they also vary in thickness. Hayashi carefully calculates how much gamma radiation to apply to different parts of each tumor. We accompanied Samuelson on the day of his gamma knife surgery. His head is first fixed in place, so it won't move during the procedure. Treating his tumor will take 3 hours. The device will automatically deliver radiation according to the treatment plan.
It's finished. お疲れ様。
This single treatment session is all Samuelson needs, and he won't have to take any medication. Over the next 2 to 3 years, his tumor is expected to shrink.
I think the numbness and tingling in his face will improve in a matter of months. If the tumor shrinks soon and remains small for many years, that would be wonderful.
After gamma knife, you still have the ability to, use your fingers, and it's okay. You don't lose any of that. So you come out of it the same person you were as you went in, just hoping that, of course, the gamma knife procedure was successful. I'm going to go home, be with my family, spend time with them, and recognize the value of the time we have.
So, Dr. Hashi, what about the people who are concerned about the risk of radiation, for example?
There's hardly any risk. It's no different from having chest x-rays taken during a physical. And patients can go home on the same day. Now, it is true that important nerves and brain tissue around the tumor could be affected by radiation. The risk of that happening is about 10%, but there's basically no risk that radiation will affect other areas.
And Dr. Hashi, how many machines are actually available in Japan, or how many hospitals are offering this service, the gamma knife treatment?
There are 53 hospitals in Japan with gamma knife machines. That averages out to just over 1 gamma knife per prefecture around the country. The merit is that hospitals nationwide can accept and treat many brain tumor patients.
Dr. Hashi, with this treatment, can gamma knife alone heal a brain tumor?
That depends on the type of brain tumor. If cancer metastasizes to the brain from another part of the body and the tumor is small, it may be treatable with just the gamma knife. But large tumors are a different story. The maximum size for the gamma knife is 3 centimeters. So we usually use standard surgery to reduce the size of big tumors and then use the gamma knife. And recently, some tumors have been treated with repeated gamma knife exposures.
And what's the rate of relapse? For example, if you've successfully treated a brain tumor?
The rate of relapse depends on the type of tumor. About 90% of metastatic brain tumors can be successfully treated. The chance of recurrence is 10%. For benign tumors, the success rate is 95%. So there's a 5% recurrence rate. In other words, gamma knife radiotherapy can cure most patients.
The potential and possibilities also, I would imagine. What other conditions or what other diseases is the gamma knife being used for at the moment?
Besides brain tumors, one example is an arteriovenous malformation, or an abnormal tangle of blood vessels in the brain. Another is functional brain diseases such as epilepsy and some movement disorders. I believe the gamma knife will be used for all kinds of treatments.
The gamma knife has brought hope to some patients who can't be treated with conventional surgery. 23-year-old Moe Ogura is one of them. She was 10 years old when she suffered a headache that made her feel like her whole head was being tightly squeezed. It took many hospital visits to determine the cause. Finally, she was diagnosed with an arteriovenous malformation, or AVM, an abnormal growth of blood vessels in her brain. Normally, arteries and veins are connected by very thin blood vessels called capillaries. But people with an arteriovenous malformation have extra abnormal blood vessels that shouldn't be there. Patients are born with the condition, and it's typically discovered during childhood. These extra blood vessels have weak walls, putting them at risk of rupturing. That can cause serious permanent damage to the brain and even lead to death. In Ogura's case, the malformation was located deep behind her left eye. It was impossible to remove it through conventional surgery.
A diagnosis doesn't tell you when the abnormal blood vessels will burst, and ruptures occur in 2 to 4% of patients every year. It's like a time bomb, but it's impossible to deactivate it from the outside. So you have a time bomb inside your head that could go off at any time. It's not just Ms. Ogura, but all patients with this condition.
Treatment involves cutting off the blood flow to the abnormal vessels. The gamma knife can target blood vessels deep inside the brain. Hayashi took even more pictures of Ogura's brain than he does with brain tumor patients. He analyzed nearly 1,000 images, including those of her blood vessels. This helped him direct gamma rays more precisely, even at tiny blood vessels measuring less than 1/10 of a millimeter in diameter. Irradiating the blood vessels damages the DNA of cells lining the inner surface. As a result, these cells expand over a period of a few years, gradually blocking blood flow. Once blood stops flowing, the risk of rupture is eliminated. Ogura had an exceptionally large grouping of abnormal blood vessels, so she underwent gamma ray treatments multiple times over 13 years. The cluster of blood vessels gradually shrank, and now 90% is gone. Ogura no longer suffers from crushing headaches, and she no longer feels pressure on her brain.
うまいです。バッチリ。
2 years ago, she realized her dream of becoming an occupational therapist and is working full-time. This year, she'll have her last gamma ray treatment. She's expected to be completely in the clear in another 1 to 2 years.
I think there used to be only 2 choices. One was to open the skull and remove the malformation, damaging all kinds of nerves in the process, or just leave it alone. But with the gamma knife, doctors can operate on many different parts of the brain, including areas that are deep inside. I think that without it, I might not have lived this long.
Hello? Hi there, Noah.
Hayashi has been working on an exceptionally challenging case. He believes it's the first of its kind to be treated with a gamma knife. The patient is 11-year-old Noah Takahashi. What makes her situation so unusual is that she was born with multiple arteriovenous malformations all over her brain. Last year, one of them ruptured. Before then, she was able to carry on normal conversations with her family, but the rupture put her in a coma.
There are no reports of curing severe consciousness disorders with a gamma knife. But I have treated 700 cases of cerebral arteriovenous malformations, and the technology has always been effective. I think it's a matter of getting the dose right or applying the gamma rays effectively. When the beams accurately hit the target, children improve dramatically.
First, Hayashi operated to stop the bleeding in Noah's brain. Then, he used the gamma knife to save her remaining brain functions. Six months have passed since she had the treatment.
Noah-chan. Noah-chan.
She responds more often to stimuli like touch or when people call her name. With support, she can now assume a sitting posture.
I see hope. I feel more resolved than ever not to give up. In the past, I thought she might die in a week's time, but now I'm not going to give up. Never. I want to hold her hand and walk together. I promised her.
It is possible that the parts of her brain that control language are intact. So if everything goes well, I think she'll be able to speak someday. We'll continue with the therapy without giving up. And when she grows up, I hope she'll open her eyes to say, "Thank you, doctor," and "Thank you, Mom." To make that happen, we'll do everything we can.
Dr. Hashi, what areas of research or what issues do you really hope to engage in and focus on going forward into the future?
Times change, but one thing remains constant, and that's to satisfy the needs of patients. I'd like to keep offering the kind of treatment that patients are glad to receive. I hope the gamma knife will become more widely available. Arteriovenous malformations are present from birth. If more people get checked early, that would be great. For example, children should go in for a brain checkup at 10 years of age and when they enter high school. If an AVM is found, it can be cured with the gamma knife. Brain checkups don't have to be for adults only. They should also be done on children, so fewer people end up suffering from this condition. I think in the next 10 years, we'll see a decline in the number of AVM patients around the world. Gamma knife therapy can now be directed remotely. In fact, I've treated patients in Taiwan without being there. Doctors in Taiwan work with the patient. They send me the patient's data through the internet, and I devise a treatment plan on my computer in Japan. Then send it back to Taiwan. A machine there starts the therapy on the patient based on the dosage plan I've created. It's as if I'm treating the patient in Taiwan. In some places, there may not be enough doctors, or it may take time to train them before they can perform the procedure themselves. But now, there's a remote option. I can treat patients from Japan without going anywhere. I've actually been doing that since 2014. And it's working well. If things go smoothly over the next 10 years, we may be able to offer treatment to patients no matter where they are.
Dr. Hashi, it's been eye-opening and absolutely fascinating, so thank you so much for your time today.
Thank you.
We've looked at how Japanese researchers and medical professionals are trying to provide hope to patients and their families through gamma knife radiotherapy. But this cutting-edge brain treatment unfortunately isn't well known yet. So it's important for medical experts to actively promote awareness for it to be a well-recognized treatment. And I'm hoping that gamma knife radiotherapy will become widespread globally and that it will become an effective choice for patients with brain diseases and many other conditions and disorders.
Our focus this time is breathing techniques from Japanese Zen Buddhism. An important part of this discipline is zazen, or seated meditation. Breathing techniques used in zazen cause a neurotransmitter called serotonin to be secreted throughout the brain. Scientists have shown that serotonin reduces stress and has a calming effect.
Today on the program, we're going to be learning a very special breathing technique which helps protect the brain from stress and also refresh the brain. And we're joined by a very special guest, neuroscientist, Dr. Arita. Thank you so much for your time today.
Glad to be here.
So what sort of symptoms would you see if you have low serotonin?
In a word, depression. You have no energy. You have difficulty getting out of bed in the morning, or you feel psychologically unbalanced. So your mental health suffers. When serotonin is released, it does a variety of things, like waking up your brain, especially the cerebrum. So let's try the breathing technique. Please, sit on a cushion.
So do we sit down cross-legged? Cross-legged?
Yes. Let's sit cross-legged. In a lotus position. It doesn't matter which leg is on top. And straighten your back. Now, when you breathe, you want to pay special attention to your exhalation. We inhale oxygen so we can stay alive. Then we breathe out so we can breathe in again. To become more aware when we exhale, it helps to make a sound at the same time. That's because vocalizing takes air out of the lungs. I'd like you to say "ah" with me, and when you do so, please exhale long and slow. You also want to pay attention to your lower abdomen. So, put your hands here like this, and please keep saying "ah" along with me. Let's do it together.
Breathing out.
As you breathe out, your lower abdomen gets pulled in. That's a sign that you're paying attention to your exhalation. Breathe out deep and slow. Breathe through your nose only when taking in air. Look down at a point in front of you. Don't close your eyes. Keep them half open as you focus on that point. Let's do it again. If you do this for 5 minutes or more, your brain will start secreting more serotonin. Various changes are happening in your brain, and you can feel the difference.
Once you get the hang of this breathing technique, try doing it for 5 minutes without making any sound. This time, it's okay to breathe out through the nose.
How do you feel?
I feel like everything is really slowed down. I have such a busy, active mind generally, and I'm always thinking of something. But I really found everything was really, I feel very different now.
Next, some exercises that incorporate the breathing technique.
First, let's try squats, a rhythmic exercise that you can do indoors. We'll move like this. You want to do it slowly. And do the breathing at the same time. Inhale and exhale. 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 As you do this exercise, it's important to keep your legs and breathing in sync. If they're out of sync, this exercise won't be as effective in activating serotonin. So, make sure to keep them in sync for more serotonin. The next one is very simple. Twist your body like this. That's all. You're rhythmically moving the so-called core muscles in your trunk. Anyone can do this. It's not difficult. Do it slowly. And exhale, exhale, exhale. You can swing your arms more. Yes. That's good.
But it's probably really good for the back as well. When sitting the whole day at the computer, it's probably great to do before sleep to also align the spine.
Now, when you're walking, try to pay attention to your breathing. We don't normally do this, but it's very effective for activating serotonin. So, walk 1, 2, 3, and 4 in sets of 4 steps each. You want to exhale on the first 3 steps and then inhale once. Ha, 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 and inhale. Ha, 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 and inhale. Let out a voice when you're exhaling. Ha, ha, ha. Ha, ha, ha. Like that. The rhythm is important. Remember, keeping your leg movements and breathing in sync are very good for activating serotonin.
So how long should we be doing this walking for?
At least 5 minutes, but try to do it for about 30 minutes. Serotonin doesn't increase when you do strenuous exercise, but when you do pleasant rhythmical exercise. So it's important to stop when you feel tired.
I just feel so much calmer and so much more relaxed. And I'm really inspired to start my breathing technique from tomorrow morning. So thank you so much for your time today.
Thank you very much.